February is American Heart Month, and while heart disease is usually associated with diet, exercise, and genetics, research shows there's also a strong link between heart health and mental health.
Dr. Mariam Wahby is the manager of behavioral health education at Memorial Hermann. Good morning to you, doctor. Thanks for being here.
Thank you.
So let's talk about this connection. How is there a connection between stress and, I could imagine there would be, but how is that?
Sure. So not too different from what you've mentioned so far. Stress certainly has physical impacts on our body. So hormone levels, chemical levels in our body are going to affect our heart. Also things like blood flow are affected when we feel really stressed. But other ways that we kind of have a lot of control over when we feel really stressed, the ways we manage that.
Okay, so let's talk about how we can take care of ourselves emotionally to help prevent heart disease.
Perfect. That's exactly it. So when you feel really stressed out, if you're someone who kind of curls up in bed and gets, binging some sort of TV show, instead of maybe someone who turns to exercise, that sedentary state is going to kind of contribute to some of the factors linked to heart disease. When we're really stressed out, we're not thinking, I really want to make a really intricate plant-based meal with really fresh ingredients. We're like, give me the greasy, give me the salty, and give it to me quick. Those are all things that contribute to different levels within our bodies that contribute to heart disease, things like high blood pressure and diabetes.
So if you're dealing with a lot of stress, you have a lot going on, what are some ways that you can do, what are some things that you can do to balance this out and make sure that your heart health is not impacted?
We all have stress, and it's going to be a part of life. So we have to kind of develop a relationship where we accept that. We know that stress is there and that we don't always just fear it, and that we know that some portion of stress can be helpful, that it can be motivating. We use that to kind of drive us to do those healthy things. So drive me to exercise so that I don't develop a condition that really does have a chronic impact on my life. Use it to push me to get some professional help sometimes. Maybe I do need to talk to a therapist. Maybe that's a really great gift I can give myself. Or develop some mindfulness habits. So I'm really being present when I'm eating. I'm really being present when I'm showering. Just practicing some deep breathing throughout the day doesn't mean that I have to go on a month-long retreat somewhere. It just means that in the moment I'm paying attention to what I'm doing while I'm doing it.
And you mentioned exercise, which we know makes such a big difference. But what about eating healthy? I feel like that's the thing where everybody's just like, la, 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 I don't have time, or it's too stressful to figure it out. But what are simple tips that are doable? I think moderation's key. You can cheat, but heart healthy ideas to help protect our ticker.
The best part about this, or any kind of thing you want to add into your life, is think of it in terms of adding versus reducing or subtracting something else. So I'm never going to eat pizza again. Pizza's wonderful, but can I add something else in? So if I'm going to have pizza, can I have a little salad, a little fruit, something fresh with it, so that I am still nurturing my body and creating in myself a desire for those pieces. So I do want the fresh, healthy item, in addition to the craving that I have, the need that I want, because it's still okay to have that too. And
really quickly here, getting enough sleep, going somewhere and laying down, as my mama always says. I'm sure that is important too to help you deal with stress and your heart health as well.
Of course, we trade sleep for extra work hours and for socializing. We pack our days and our lives so full to feel so busy. And so you're right, prioritizing sleep is tremendous. And then really good sleep hygiene. Am I sleeping in a dark room with the TV off? Am I having some time before bed without a screen? So really prioritizing your sleep and the environment before, so that you're getting good quality sleep during the time that you are getting to sleep.
And another dreaded one that no one wants to hear: limit alcohol, don't smoke, and those things can make a difference as well. Dr. Wahby, thanks for taking time for Memorial Hermann today. What a powerful conversation.
Thank you.